For the low back, we're going to be focused on the Quadratus Lumborum and the rector spinae. You can see the Quadratus Lumborum connects from the bottom rib to the ilium as well as each of the vertebrae. Using two lacrosse balls, we're going to focus on the more medial part first with the lacrosse balls touching. Then we will work our way towards the sides. Laying on the ground, place two lacrosse balls touching underneath the low back. Bend your knees and allow yourself to relax in the position. Once the balls are in place, create a pelvic tilt by squeezing your core firm. Then, moving in the opposite direction, press the tailbone into the floor. There should be a slow and controlled movement. Perform 7 to 10 repetitions with the lacrosse balls in the first position. Then, move them out towards the sides. Again, contract firmly with the core, which should press your back into the lacrosse balls. Then, move the opposite direction and press the tailbone down into the floor to create a contraction of the low back muscles. To get even more intensity in the low back, we will place the ball in the low back muscle tissue and then roll onto the ball. To get even more intensity, we're going to work one side of the low back. Place the lacrosse ball under one side and then roll onto the ball. Create a contraction, bringing the knee towards the chest and then extending all the way down to a full relaxation. Remember to keep the chest open towards the ceiling while you create the contraction. Instead of rolling forward, make sure you keep your chest pointed towards the ceiling. Again, perform this contraction sequence 7 to 10 times and then move on to the next tender area. The psoas muscle is also known as the hip flexor. This muscle goes from your lowest rib and each lumbar vertebrae all the way down to the femur. When this muscle gets tight, it's difficult to fully extend when standing out of a chair. This muscle is best released by using a massage stick and focusing on your diaphragmatic breathing. Laying down, we're going to warm up the tissue by rubbing around the obliques between the ribs and the hip. This tissue should get warmed up and you should relax, allowing your fingers to depress into the stomach. We're going to use the massage stick and create pressure midway between the ribs and hips and halfway from the belly button to the side. Take a big diaphragmatic breath in, and as you breathe out, relax and pull the massage stick into the psoas muscle. Hold the pressure and pin that muscle while you try to breathe in through your diaphragm. When you've taken a full breath, release the pressure of the massage stick and relax your breath. Without pressure, take another big breath in and relax. As you relax, push pressure back down into the psoas with the massage stick. Without releasing that pressure, take a big breath, slow and controlled. Once the breath has come all the way in, relax the pressure and relax your breath. Again, breathe in as deep as you can. Relax, apply the pressure, then breathe in, maintaining that pressure. Release the pressure from the massage stick, relaxing your breath. Complete 2 more rounds. Compress the psoas muscle and hold. Take a big breath, maintaining pressure as deep as you possibly can. When you've gotten a full breath, relax and breathe out. Last one. Take a big breath. As you breathe out, press down into the muscle tissue and hold. Take a big breath this time. Hold your breath at the top for 5, 4, 3, 2, 1, and relax. Now, do the same thing on the other side.